Good afternoon. Good afternoon. Please tell your friends to join fast. Okay. My slides are visible. Please respond.
Yes, sir.
Yes, sir.
Okay. Good afternoon. So I think Asambati sir yesterday class already told how to record blood pressure and what are the different effects of posture on blood pressure. Although the basic things I'll be telling you again. So today we'll be discussing on the effect of exercise on blood pressure. Can anyone tell me what is the definition of blood pressure? Anyone? Shrushti? Shrushti, can you tell me?
Yes, sir. The pressure exerted by the flow of blood on the walls of the blood vessels.
The pressure exerted by?
Flow of blood
Hmm.
on the wall of the blood vessel.
It is the medial pressure or lateral pressure?
Lateral.
Yes, you should mention that, okay?
Yes, sir.
Hmm. So, coming to the definition of blood pressure, we can say this also that the arterial blood pressure is the pressure of the column of blood on the vessel wall in the arterial system. Now, what are the components of blood pressure? There are four components when you record the blood pressure. One is systolic, then diastolic, then pulse pressure, then mean blood pressure. In short form, we call SBP, DBP, PP, and MBP. So, what is the systolic blood pressure? Maximum pressure exerted during a systole. The diastolic blood pressure is the minimum pressure exerted during diastole. Now, if you deduct diastolic blood pressure from systolic blood pressure, you get pulse pressure. And when you say about mean blood pressure, it is diastolic blood pressure plus one third of pulse pressure. Blood pressure is expressed as systolic blood pressure by diastolic blood pressure always. Every time routinely we do not say what is the pulse pressure or MBP. You might have seen the physician or the doctors are saying your blood pressure is 130 by 90 or 120 by 70 like this. We do not mention routinely the pulse pressure and the mean blood pressure. Among the systolic and diastolic, the diastolic blood pressure is the most important. Uh, most important. So although all the components are having their different important like significance, so normal blood pressure as per the new guidelines of American Heart Association is systolic 120 and diastolic 80 less than. So it will be always and always less than 120 systolic and less than 80 diastolic millimeter of mercury. The average value of the ratio of systolic BP or to the diastolic BP is 3:1. Have you ever seen the BP machine, the sphygmomanometer? You have seen
Yes,
whenever
sir.
you are,
Yes,
whenever
sir.
you are getting admitted in any hospital for any disease or you visited some physician, you have seen sphygmomanometer, no? So there is a curve. There is a curve in the. I am talking about the mercury sphygmomanometer. There is a curve. Then there is a mercury scale, and there is a balloon. So all the components are having their different important significance. You should remember then the size of the cuff is it varies from the different age group to different age group, and also it varies like depending on the circumference of the arm. Okay, on the same is for pediatric people, like for children, it is different cuff size. For adult group, it is different cuff size. But if you take adult group also, the person like whose are the fatty person, for them we need a longer cuff. For like normal people, we need a normal cuff. So it varies. But what you have to remember is, for adult people, when we are recording blood pressure, we should always tie the cuff on the upper two-third of the arm, not the lower. Don't do this in the examination also, and while you are treating the patient or examining the patient also. Blood pressure cuff should always be placed at the upper two-third of the arm. Okay, and it should be like put so much tightly, not so much tightly and not so much loosely. Okay, the normal tightening should be there. Coming to the factors that affect the arterial blood pressure: sex, body build, climate, diurnal variation, exercise, emotions, gravity. Hereditary factors are also there: meals, your sleep pattern, posture. All these factors are important, but in practical examination, when first year MBBS practical examination, when you give, two things we ask so much routinely. One is the effect of exercise, another is the effect of posture, which include the effect of gravity also. So, and others are all the Viva questions. Always remember that your practical examination at the end of first year will be comprising of three parts. One is hematology, another one is clinical experiment, another one is your human experiment. So 50%, almost 50%, like will get a experiment on blood pressure. Either it be on posture or on exercise, but 50% student will get a question on blood pressure. So from exam point of view, it is very much important. You can ask your senior batch students, they also got the same, and it is very much scoring topic. You can score like 80% to 90% mark. Okay, just don't do the blunders during the examination. So these are the factors. After that, today's topic, which we all know that we'll be discussing the effects of exercise on blood pressure. So for that you need to know what is mild exercise, what is moderate exercise, and what is severe exercise, degrees of exercise. Because depending on these degrees, the effect on the blood pressure, it varies. So what type of exercise are called as mild exercise? In this case, the oxygen consumption is 0.5 to 1 liter per minute. Work done is 150 to 350 watts, and rise in heart rate is about 25%. That's the basal heart rate. If you take the basal heart rate, or the basic heart rate is as 80, the heart rate will increase to about 100 per minute. Almost 25% increase will be there. This is called mild exercise. When you see the moderate one, in case of mild it was oxygen consumption 0.5 to 1. In moderate one it will be 1 to 2 liter per minute, and the work done where the mild one is 150 to 350, here it is 350 to 550 watt. And the rise of heart rate, if you take the basic heart rate of 80, it will be like up to 120 per minute, which is almost 50%, almost 50% increase in the basal heart rate. Now compare these two with the severe exercise. What do you mean when you call it a severe exercise? Oxygen consumption is more than 2 liter per minute, work done is more than 550, and the rise of heart rate is almost about 75 to 100%. That is, if you take the basal heart rate is 80, so the heart rate will increase to about 150 beats per minute. So that now the point is why we are discussing this. We should why should not we are straightforward in going to the blood pressure according the effect of exercise chart. This is because see the values will differ from what type of exercise you are doing. Suppose you make a circle of the BLD ground one time, and your friend make a circle of the BLD ground 3 times. Okay, so you make a circle of BLD during running circle of one circle. So in that one circle, the heart rate will increase, will be a little bit lower than that person who have done it for the 3 times continuously. So because the muscles involved on that person is more than you, so you have to so the BP changes, heart rate changes, all the cardiovascular changes will be more prominent on him than you. So the degrees of exercise are important when you are discussing the effect of exercise on blood pressure. Any confusion till now? Arihant? Arihant, any confusion? Sleeping. Okay. So, types of exercise. See, here we have seen the degrees of exercise. Now, what are the types of exercise? We can divide it into two types. One is isotonic exercise, another is isometric exercise. Isometric exercise is also known as tonic exercise. Now, what is this isotonic exercise means? See, in this type of exercise, there is a change in the muscle length, and exercise is in a phasic manner. It is in phasic in nature. You can take the example of a person walking or a person jogging or running. Okay. Now, in this isotonic exercise, see what are the cardiovascular changes are seen. Increased heart rate will be there, stroke volume will be there, cardiac output will be increased, increased heart rate, increased stroke volume. So as you all know, the stroke volume multiplied by heart rate equal to cardiac output. So if heart rate is increasing, stroke volume is increasing, so cardiac output will also increase. Systolic blood pressure will increase. Systolic blood pressure will increase. Systolic blood pressure will increase. I told you 3 times, it has a reason. Systolic blood pressure will increase. Blood flow to the exercising muscles will increase. Diastolic pressure increases in mild exercise but doesn't change or decrease in moderate exercise. Diastolic blood pressure increases in mild exercise, but diastolic blood pressure doesn't change or it might decrease in case of moderate exercise and always decrease in severe exercise. These are the questions which will be asked after you have written your report by the external examiner or the internal examiner who will be taking your examination. So again I am reading for you. Cardiovascular changes in isotonic exercises are increased heart rate, increased stroke volume, increased cardiac output, systolic blood pressure will be increased, blood flow to the exercising muscles will be increased, diastolic pressure increases in mild exercise. Either it will decrease or it will not change in case of moderate exercise, and it will always decrease in case of severe exercise. Now come to the isometric exercise. Okay, or the tonic type of exercise. So here in this type of exercise there is no change in the length of muscle and the exercising muscles remains contracted throughout the maneuver. Common examples is pushing against the wall or who are the trained gym goer, like who goes to gym regularly. Now, what are the cardiovascular changes here? Heart rate rises at the start of exercise. This is mainly due to the decreased vagal tone. Due to this decreased vagal tone, it is called as tonic exercise. Heart rate rises at the starting of the exercise. This is mainly due to the decreased vagal tone. Increased discharge of the cardiac sympathetic fibers may also contribute to this phenomenon. Now, blood flow to the exercising muscle decreases in this isometric exercise, while systolic blood pressure and diastolic blood pressure both rises very sharply. Stroke volume changes relatively little. This slide will this slide in the BP examination, if you got the exercise, will contain almost 30% of your questions will be asked by the examiner from this slide only. Please remember. Any confusion till now? Any confusion till now? Okay. There are only 65 students, 66 student, 65 student present. Can I ask the reason, please? Are you becoming that much lethargic so that you cannot open your phone or laptop and you cannot listen to the lectures also? If this is the reason, if this is the way, then I will ask HOD ma'am to cancel all the classes. This much attendance means, okay, because this is straightway insult to the teachers. Okay, what I feel, and I don't think I will be helpful in the examination if your way of behaving to the class, way of attendance behavior in the class will be like this. I don't think I will be helpful. Don't mind and don't say, sir, why this thing is happening in the examination. Okay? I am warning you, first time and the last time. Any question till now? Any question you can ask, otherwise I will ask question. Aditi D. Aditi sleeping. Okay. Arun Anup.
Yes, sir.
Okay. Arun, can you tell me what is isotonic exercise?
Yes, sir. Isotonic exercise is something which contract muscular contractions occur without movement of involved parts of the body.
I think you have to read it again. Okay. Anyway, at least one student answered. Any more question? Any question? Sorry, any question from the present 63 students? Let me take the attendance of everyone who is sleeping. Arun George Jacob.
Yes.
Okay.
Sir.
Aditi. Sleeping.
Yes, sir.
Just
Sir, I'm there,
one,
sir.
yeah, 1 minute ago I asked your name. You didn't respond. Why so? Eileen Bhargeshri. Sleeping. Anusha B.C. Arjun B.
Yes, sir.
Okay. Any confusion?
No, sir.
Chaitanya Sharanagat. Age Prithvi.
Yes, sir.
Okay. So almost 50% of the class is only logged in and they are not listening. Don't worry. I will see. Thank you. If there is no question, I will conclude the class here only. Before concluding, this is the way you should present. This is the report. Okay. In the exam, you have to present the report. So first of all, you have to take the recording of blood pressure in the resting. Along with systolic and diastolic, you have to mention the heart rate also. Resting after, like a person, you have to allow a person to rest for 10 minutes. After resting for 10 minutes, you have to take the blood pressure of the person. After 10 minutes of like you'll allow the person, after recording you'll allow the person to like for some exercise what you want to record, either mild, moderate or severe, what is given in your exam, I don't know. After the exercise 1 minute, after 1 minute of exercise completion, you will record the blood pressure, heart rate again. After 2 minutes you will record it again. After 3 minutes, 4 minutes, then after 10 minutes. Remember 1, 2, 3, 4 and then add it together. 1 plus 2 plus 3 plus 4 equal to 10. After 10 minutes of exercise. So we have to give 6 recordings here. 6 recordings you have to put. Now after putting this report, uh, the inference you have to give the at what time, after how much time it increase or how much time it is decrease. This is a homework for you. Any question, any confusion?
No, sir.
Meet you at 21st of this month.
Thank you, sir.
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 Thank you, sir.